Nursing is the backbone of the American healthcare system. Nurses deliver hands-on patient care, manage complex treatment plans, and coordinate services across every setting, from hospitals and nursing homes to schools and community clinics. They are the single largest group of healthcare professionals in the country. Yet today, we have a nursing shortage so severe it threatens patient safety and access to care. The chronic understaffing of nursing increases burnout among nurses and increases attrition, leading to a vicious cycle. The nursing shortage is associated with higher mortality rates, more medical errors, longer hospital stays, and higher readmission rates. And federal workforce data show there are 200,000 registered nursing job openings every year, and 1 out of every 10 nursing positions in hospitals remains unfilled. And the demographics are not on our side. The population in America is aging rapidly. By the end of this decade, every member of the baby boom generation, 73 million Americans, will be over the age of 65. This dramatically increases demand for health care in this country, especially long-term care, chronic disease management, and complex medical interventions. But at the same time, the nursing workforce itself is aging. The average nurse in this country is in her mid-50s, and 40% plan to leave the profession by the end of the decade. But the nursing shortage is not driven by a lack of interest in nursing. Each year, tens of thousands of qualified applicants are turned away from nursing schools in this country, not because the applicants are unprepared, but because the schools lack the capacity to train them. This is due to faculty shortages, limited classroom space, lack of clinical training spots, and all these conspire to prevent the workforce from replenishing itself. And the faculty shortage is especially acute. Nursing schools require faculty to hold advanced degrees, but those same nurses are in high demand in clinical settings with better pay and benefits. So as a result, nursing schools struggle to attract and retain the educators that replenish the workforce. It's been 15 years since the Institute of Medicine's Future of Nursing report, and the percentage of nurses with bachelor's and doctoral degrees has grown over that time, but demand for highly educated nurses still outpaces supply. This makes it harder to replenish the system, to hire faculty, and to train the next generation of nurses. And unfortunately, policymakers sometimes make the problem worse. You would think they would want to embrace the opportunity to expand capacity at nursing schools, but some state and federal regulators have actually tried to restrict it. In California, the state with perhaps the worst nursing shortage in the country, public universities routinely deny over 70% of nursing applications due to capacity restraints. But regulators have moved to limit enrollment growth at high-performing private and for-profit nursing schools because those regulators are motivated by a resistance to for-profit education rather than focusing on outcomes and quality of schools. State nursing boards in other states have inexplicably moved in the same direction. Now, at the federal level, Congress has taken a nonsensical approach of limiting financial aid for nursing students based upon new definitions of what constitutes a professional degree. These approaches are counterproductive and do more harm than good. If you want to address this crisis, it's going to require a comprehensive approach, like using technology to maximize the effectiveness of the way we educate and train our nurses. Distance learning and online education have become essential tools across all of higher education, and nursing should be no different. And when paired with rigorous accreditation standards and clinical partnerships, hybrid and online nursing programs can increase capacity without sacrificing quality. simulation labs, virtual clinical scenarios, remote collaboration tools. These allow students to practice complex skills in controlled environments. And no, they cannot replace direct patient care, but they can supplement and prepare students to enter healthcare settings. Now, retention of current nurses has to also be a priority. Burnout and stress are the leading drivers of nurse attrition. So hospitals have to prioritize better onboarding of new nurses, flexible scheduling, mental health support, and professional advancement. Investments in workplace culture are not luxuries, they're necessities. And finally, we must expand the pipeline into nursing careers. Certified nurse assistants, licensed practical nurses, and medical assistants are a natural talent pool, but too few are able to advance because of admissions criteria, logistical barriers, and lack of financial support. We can unlock this opportunity for them by providing better opportunities for professional growth. And early exposure also matters. High school, career, and technical education programs, healthcare academies, partnerships with local hospitals, these introduce students to nursing before they change direction, before they choose another career. The earlier we reach these students, the earlier we engage, the more likely they are to choose nursing as their career path. So you see, the nursing shortage is not a single cause problem, and it won't be solved by a single action. And policymakers cannot let their ideological biases get in the way. If we succeed, we can stabilize the nursing workforce and strengthen the entire healthcare system. But if we fail, the cost will be borne by patients, families, communities, and taxpayers across America. The choice is clear, and there's simply no time to wait.